Welcome. We are Group 3. The title of our presentation is Strengthening Patient Relations Through Effective Communication from Hamilton Chapters 11 and 12. My name is Orquidea Acevedo. I am the Director of Care Coordination at Found Care Health Center, and I have been in healthcare for nearly 20 years. And I am joined by...
Hello, my name is Sofia Vasquez. I'm a child enrichment specialist at JAFCO. I also work at an animal hospital and have been there for 4 years.
Hello, my name is Yvonne Gregoire. I work at ChinMed as a care promoter. I have been in healthcare for 20 plus years.
Hello, my name is Morgan Tragemann, and I am a dog hand for a company called Freedom Boat Club. I have had this job now for 3 years. The purpose of this presentation will highlight how audience analysis and communication techniques improve patient care, understanding, trust, and engagement in healthcare.
Believe it or not, but 60 to 70% of serious medical errors happens because of communication failures. Miscommunication is one of the leading causes to poor patient outcomes. Effective communication begins with understanding who you're speaking to. And once we are able to understand who we are speaking to, we're able to effectively communicate information clearly, build trust between our patients, and overall support the patients and improve patient outcomes as a whole.
Preview. To better strengthen patient-provider relationship, we apply effective persuasive communication as well as understanding our audience by tailoring messages. We use verbal and visual communication and speech anxiety.
This presentation is broken down into 6 sections. The first is audience analysis, followed by verbal and visual supporting materials. Next, we move on to managing speech anxiety and how to improve the delivery. We then apply these concepts to some scenarios in an engagement activity and conclude with a summary. So let's first take a look at audience analysis. Audience analysis tailors communications to the specific individual. It is not a one-size-fits-all. It focuses on 1, audience characteristics, which include size, roles, cultural differences, knowledge level, and bias. Next, we will look at audience types. Are the audience friendly, neutral, uninterested, or hostile? Then we're going to look at how audience analysis shapes communication. Communication and how it's organized, delivered, and the supporting materials. Now that we've gone over this, we're going to take a deep dive into verbal and visual supporting materials.
Verbal and visual supporting materials are both methods that Hamilton discusses in his chapters that help enhance communication overall and help better improve understanding with our patients. Visual supporting materials refers to things that we look at to help better understand our medical information. This can include brochures, diagrams, and charts. All these visual aids can help support the patient's education and the medical information that we are conveying to them, and overall improve treatment compliance. Verbal supporting materials refers to the examples and explanations that we use to help simplify medical information. By using these methods and adding statistics and evidence to them, we're able to build credibility and trust between our patients. Some examples of these supporting materials, as mentioned, examples and explanations. We can use examples and explanations to help simplify medical information. For example, if I'm speaking to a patient that was recently diagnosed with hypertension, instead of saying hypertension, I would go by saying you have high blood pressure. by explaining that and using statistics and evidence to support that information and source credible sources, I'm able to reinforce trust within the patient and the information that I'm giving them. Some visual aids I can provide to help better understand their hypertension diagnosis are brochures, which are easy to read information that they can review at home at their own pace. Diagrams, which help explain how hypertension, for example, would relate to their entire body system and how their medical condition affects different parts of them and the procedures that they will be undergoing to help improve it. Charts are a form of visual aid that help display the health information and how the medication that they'll be taking and treatment progress will affect them. And by using visual aids as a whole in combination with verbal aids, we're able to reinforce patient education and overall improve their understanding and treatment compliance. Now, we'll take into account the different types of communication and how we are able to use verbal and visual aids to adapt in conversations with our patients. We take that into account with patient demographics, and that is how we are able to use audience analysis and apply it to better understand how we can deliver effective communication.
Managing speech anxiety. In order to manage speech anxiety, we need to understand what is anxiety. Anxiety help you communicate with confidence, clarity, and professionalism. As future healthcare professionals, reducing presentation anxiety enable you to educate patient more effectively, build trust, and strengthen patient-provider communication. Understanding speech anxiety. Speech anxiety is one of the most common fear experienced by speakers. Anxiety can produce physical and emotional symptoms that interfere with communication, including increased heart rate, trembling, and difficulty concentrating. Understanding these reactions helps speakers recognize that anxiety is manageable. Confident communication improves patient understanding, trust, and to treatment recommendation. When healthcare professionals allow anxiety to interfere with communication, patient may feel misunderstood when it comes to their care, as well as they will feel less confidence in their provider. Preparation technique. Research and organized preparation. Research and organize presentation material thoroughly. Where organized presentation also make it easy for you to interact with the patient, engaging in healthcare information. Practice the presentation several times, also make it more easy for you to work on your speaking. Practicing also allow healthcare professionals to communicate with patients to educate them more clearly and accurately, improving patient comprehension and satisfaction. Lastly, when it comes to delivery, using positive speech, self-talk, deep breath, visualization before presenting, remaining calm help healthcare professionals communicate with empathy and confidence during patient interaction. Focus on the audience need rather than personal fear. Instead of worrying about making mistakes, concentrate on helping patients understand their diagnosis, treatment option, or discharge instruction. Now we move on to improving delivery.
Improving delivery, there are many factors that influence how well a speaker delivers their presentation in patient relations. There are different delivery methods. The most effective method of delivery is extemporaneous speech. This type of speech is when the presentation isn't fully memorized. If notes are included, the words on the notes are not written word for word. This speech may be used when healthcare providers are about to explain a diagnosis to a patient, provide discharge instructions to a patient, or explain a treatment plan. Along with extemporaneous speech, there is speaking with visual aids. Examples of this type of delivery in patient relations may include a healthcare provider speaking with visuals such as ultrasound images, diagrams, or medication schedule charts. Another method of delivery is speaking from memory. This type of method may be somewhat challenging as it requires a lot of memorizing, along with a speaker can lose their train of thought. Speaking from a manuscript is another method of delivery. This is when a speaker speaks word for word from a prepared presentation. Impromptu speaking is when a speaker delivers a presentation without using any notes or preparing for it. Impromptu speaking is used a lot in patient relations as patients ask questions and healthcare workers must come up with the answers on the spot. These different types of speaking can help improve the deliverance of presentations in health relations. Along with delivery methods, delivery characteristics also play a role in determining the effectiveness of a presentation. Here are some delivery characteristics. Speakers should vary volume, pitch, emphasis, and rate. It is important for a presenter to talk loud, but yet still keep their voice soft. Speakers should also vary their pitch so that they can add interest and enthusiasm. If a speaker speaks in monotone, it might make the audience bored. Varying emphasis allows for certain words in the speech to have significance. Rate is important as well to vary, as a speaker should not maintain the same rate as it can cause for the audience to get bored. By doing all of these things, this helps make a presentation more interesting and helps better engage the audience. Informal language is a delivery characteristic the speaker should use, as they should avoid technical words and should stick with simple words, as this will help the audience better understand what is being said. In patient relations, many patients will not understand medical terminology, so it is recommended that healthcare providers use simple words. Eye contact is another delivery characteristic. Speakers should maintain eye contact with their audience as it creates a stronger connection. When healthcare providers make eye contact with their patients, it helps improve trust and understanding. Along with the delivery characteristics, being able to maintain confidence is another factor that is crucial. Some methods that help improve confidence are practicing the presentation many times to fully gain all of the information, practicing it in front of an audience, and then having speaking notes prepared. In patient relations, healthcare providers must be confident in what they are saying. Speaking with confidence helps patients trust the information they receive and also can encourage patients to ask questions about their health.
In this next part of our presentation, we will be going over some scenarios and how we would apply the skills that we have learned to these scenarios.
Scenario number 1, a 45-year-old Latina mother with limited literacy and a demanding work schedule who relies on hospital visits for urgent symptoms. She wants to know how she can improve her health without interrupting her daily schedule. How would you approach that? Well, the first thing that we have to identify is her limited literacy needs. Does she understand? What from the things that we spoke about does she need to understand the information? We have to take into account her demanding work schedule. Are the clinic hours open when she can get here? Does she have travel to come to the clinic? Therefore, we cannot just explain to her what her condition is without taking into account who she is and how we can meet those barriers to ensure that she gets the care that she needs.
Scenario number 2. A newly hired nurse feels anxious about explaining a treatment plan to a patient. Before entering the room, the nurse goes ahead and review the patient information in her chart, organizing key points, practicing common technique. During the conversation, the nurse speaks clearly, maintain eye contact, and listen to concern and answer question directly. If unsure of an answer, the nurse states they will confirm the information and follow up. The interaction concluded positively, leaving the patient informed and reassured.
Scenario 3. A 68-year-old patient with limited health literacy visits a primary care clinic for a follow-up after being diagnosed with hypertension. The patient appears anxious and confused about their condition and medications. The healthcare provider must explain the diagnosis and treatment plan in a way that the patient can understand and follow. How should this scenario be approached? I would approach this scenario with the skills that I know and first analyze that this is a 68-year-old patient with limited health literacy. Therefore, using audience analysis, I would curate the forms of communication I would use, both verbal and visual, to help her better understand her recent diagnosis of hypertension. I would use verbal examples by simplifying hypertension. Instead of saying hypertension, I would say high blood pressure, and incorporate different types of sources and statistics that can help her build trust in the information I'm giving her and also build trust between patient and provider. I would then provide her some visual aids that would show how hypertension affects her body and how the medication she would be taking would better improve her health outcomes. And while doing all of these things, I would also speak confidently, slowly, and clearly to help better convey and interpret the communication method that I will be giving her. All these methods will help overall better understand how we will be helping her and how she can help herself by following the treatment plan and how her diagnosis will affect her in the future.
Scenario number 4 is a 30-year-old patient recently had a CT scan of their brain after experiencing frequent migraines. How would you approach this scenario? I would approach this scenario by speaking confidently while maintaining eye contact with the patient. I would use simple language while informing the patient of their results versus like using any like medical jargon. Um, I would encourage the patient to ask questions, make sure they understand the information, and explain the next steps in their care. Um, this would help the patient feel informed and comfortable.
So what did we demonstrate here today? Audience analysis improves comprehension. That's one. We saw how verbal and visual tools help it enhance understanding. We saw how we build trust between patients with effective communication and manage speech and anxiety to communicate with confidence.
In conclusion, here are the key takeaways. First and foremost, you must know your audience. By identifying the audience, then you know exactly how to approach each individual. Because let's be honest, not everyone are created equal. So the way you approach a male patient is not the same way you approach a female patient. We also have used verbal and visual tools, which is a good technique when it comes to communicating with patients. And then we also practice managing anxiety. And then lastly, we had delivered with clarity.
After going over all those different points and how we can effectively communicate with our patients, I have one final thought for you to take with you. Communication is more than a skill. It is a vital part of patient care, and when we do it well, it can truly change a patient's experience. Thank you for listening to our presentation, and if you have any questions, please include it in the discussion board. Thank you.